Okay, psychological complications. Well, we think of the blues, and the blues are kind of common. How do we know if it's moved beyond the regular old blues, which may be miserable, but they're not too much of a big deal? There are depression scales described in your text. Women may be anxious and irritable. A little bit of that? Okay. We'll do a little bit of differential diagnosis in a minute, but that's the kind of stuff we're looking at. Are they having a hard time concentrating, or do they seem very forgetful? Are they having trouble sleeping? Either they're sleeping all day long, or they can't sleep at all. Have they had appetite changes? And are they having fatigue and tearfulness? Don't these things all sound like things related to depression? Yes, they are. And that's what we're trying to hopefully rule out with these people. Now, there's 3 levels here. We've got the postpartum blues, postpartum depression, and postpartum psychosis. Now, the blues, it lasts a couple weeks. It's self-limiting, transitory. It means it comes and goes. They may have crying jags, but it doesn't last. They may be upset for a little while, but it doesn't last. They may yell at somebody, but it doesn't last. So this one is a bit stressful, but it's common and it's going to go away by itself. They're not going to hurt themselves or their children with this one. Moving up a step, we've got postpartum depression. This is more serious and it's persistent. It can last for weeks or for months, and it usually doesn't begin until 1 month postpartum. So this isn't an immediate thing. This happens later. It's a downward spiral of emotions. Things just keep getting worse and worse. She's more and more depressed. And she needs intervention, but fatigue is a common problem with depression, so she may have trouble getting herself up and going to the doctor. So when you see her in the doctor's office, you need to ask specific questions about this. When she comes in for the 6-week checkup, it's the perfect time to be asking her about this. And also while she's in the hospital, doing the anticipatory guidance with her and her family members. It is not her fault. It's nothing she did. It just happens. Now, people who have previous psychological problems are more prone to get this. But it's not like she caused it for herself. Now, the postpartum psychosis is the real bad one here. It can happen birth to 3 months, but it can happen anytime in that first year. People have the disturbed sleep, emotional lability. That means they change emotions very quickly. They go from happy to sad to elated to depressed. They may be confused and disoriented. They have hallucinations. They may have delusions. They may withdraw from people. This is an absolute medical emergency. This is the one that is more likely to be related to someone killing themselves or their children. Now, it is possible with postpartum depression, but this is the one that it's most commonly seen in, and people absolutely need to go see the doctor, and medication is usually part of this. They get started on some kind of medication. Okay, what do we do? Psychological complications in general. Hopefully, prenatally, people have started talking to them about this. As part of the prenatal visits. In the hospital, we continue with this kind of teaching. And then at the 6-month checkup, or if you're working in pediatrics, when she brings the new baby in a couple weeks, and your monthly checks, the pediatric office is the one that has closer, more frequent contact with the mom. For the obstetrician, you see them at six weeks, and then for many of them, that's it. We help them to understand the lifestyle changes And that, yeah, even though you wanted this kid and you planned for it, reality really is different, and exhaustion is part of being a parent. Providing them realistic information. They're not going to be able to have the life they had before. Some things are going to have to change. Dispelling the myths of the perfect mother. Nobody's a perfect mother. Nobody's a perfect father. It's just not going to happen. Helping them to set realistic goals for themselves and their children. Again, educating them about the problems, the blues, the depression, the psychosis, and offering referrals when they're needed.